I, Tanu Yadav. I, Anushree Dixit. I, Mansi Mishra.
I, Tanveer Rashid.
So, starting with the prevalence and association and organizations related to HIV/AIDS. Prevention is better than cure, especially when someone has no cure. HIV/AIDS, acquired immunodeficiency syndrome, a condition which is caused due to human immunodeficiency virus that leads to the depletion of immune function as well as CD4 T lymphocyte count. The first case of HIV was reported in 1981. Since then, nurses are playing a key major role in its prevention and spreading awareness regarding the same. The prevalence rate of HIV at global level, according to World Health Organization, was 39 million by the end of 2022. And according to National AIDS Control Organization, it was 24 million in India and 1.60 lakh in UP by the end of 2021. Now moving further to its mode of transmission. HIV can be transmitted horizontally as well as vertically. The horizontal transmission includes needle stick injury, sexual intercourse, contaminated blood and blood products. The vertical transmission includes mother to child transmission. Now, the clinical staging, which is given by World Health Organization, is clinical stage 1, 2, 3, and 4, which leads from asymptomatic state to a progressive vigorous symptoms, which includes Kaposi sarcoma, tuberculosis, bacteremia, septicemia, encephalopathy, herpes zoster, herpes simplex, candidiasis, etc. HIV can be diagnosed using various tests like ELISA, PCR, Western blot, etc. Now, I'm going to discuss about the association and organizations related to HIV/AIDS. The first foremost important organization in Uttar Pradesh is UP-SACS, which is Uttar Pradesh State AIDS Control Society. It was established in 1999. It is run and managed by the project director, which is from Indian Administrative Service. Their key objective and programs are sentinel surveillance, targeted intervention, sexually transmitted infection management, antiretroviral therapy, blood safety, finance, information education communication, integrated counseling and testing centers. The next important organization is National AIDS Control Organization, which was established in 1992 under the Ministry of Health and Family Welfare. Their key objectives are promoting awareness regarding HIV/AIDS and preventing its spread in the society. The national helpline number for HIV/AIDS is 1097. National AIDS Control Organization also collaborates with other stakeholders, agencies, and non-governmental organizations to serve for several key policies, which includes prevention of mother-to-child transmission, promotion of safe sexual intercourse, prevention of needle stick injury, and addressing to the social and economic impact on people having HIV/AIDS. Nurses also form association among themselves. The two most important associations are ANAC, Association of Nurses in AIDS Care, and NHNA, which is National HIV Nurses Association. Their key policies are providing evidence-based approach in patient care, providing HIV-related services, providing care to the underserved and vulnerable group of people, and providing a balanced and equitable distribution of resources. The next important non-governmental organization in UP is UPNP+, which is Uttar Pradesh Welfare for People Having HIV/AIDS. It is run and managed by HIV patients itself. Their key objective is to meet the need of the people having HIV/AIDS. They promote their quality of life, they promote the sense of belongingness, and also ensure their active participation in the society. Thank you.
And Anjali have already discussed about prevalence, organization, and association. Since HIV or AIDS have associated stigma, so I will be dealing with stigma and discrimination about the HIV. HIV stigma is the negative attitude and belief faced by the people living with HIV. It is a prejudice that comes with labeling the individual as socially unacceptable, and these are often looked down due to some certain characteristics. and are unfairly treated in the society, and it is known as the discrimination. There are various types of stigma such as self-stigma, felt stigma, and enacted stigma. Self-stigma happen in form of self-hatred, shame, and blame, as these are often looked down and judged by the society. Felt stigma may be due to pre-existing factors like gender, caste, and sexual orientation and poverty, and also due to HIV related facts that it is incurable and life threatening. And enacted stigma may take form of neglection and socially isolating the people and often denying to provide health services. And what are the causes of the stigma? It is due to lack of information and knowledge about the HIV transmission. Also, it is believed that HIV is a punishment from the God and due to illicit sex or drug behavior. And now, what are the impact upon these people due to this stigma? It is it affects the individual psychologically and mentally due to this stigma, and also discourage them to take appropriate measures such as counseling and medical services, and also to get tested for their HIV status and to disclose it with their partners. And it also discourages them to appropriate measures, and it also lead to shame, blame, and despair in their life. Now, let us discuss the role of nurse in to reduce this stigma. Nurse, along with other healthcare workers and social workers, participate in community settings and the awareness program to dismantle this stigma and to decrease the discrimination and fear. Nurses also aid in counseling processes and also empower these to face the societal challenges that may be faced by these people. And also, as a whole, they participate in the healthcare setting and the community and the ground level community to dismantle the myths and misconceptions about this stigma. As said by Patricia, HIV advocates that it is not the disease or virus that kills the people. It is the hatred and discrimination upon them. Thank you.
As we know that HIV is not curable, but it is preventable. So let us discuss how it can be prevented and how it can be treated. The evolution of HIV into a chronic disease implicates that people suffering from this condition will require ongoing medical attention, antiretroviral treatment, and support from health workers. Hospitals are still struggling to deal with the challenges such as uneven doctor to patient ratio. Keeping this in mind, WHO has recommended task shifting from doctors to nurses. According to Liu and Holzma, when the task is shifted from doctors to nurses, it has increased the access to ART and retention in care. Now, let us discuss how nurses act in prevention of HIV. They can teach about the mode of transmission, especially to the eligible couples through videos, images, etc. They can be taught about how to use condoms. Every time during sexual intercourse, different condoms should be used. Ongoing reinforcement through continuous support should be provided, and patient must be encouraged for follow-up care, and it must be ensured that all the processes are in place for follow-up care, like primary care and primary health centers. Nurses also play a vital role in identifying the high-risk groups and telling them about its consequences. They can also teach them about the pre-prophylaxis programs. If a woman is pregnant, she must be screened for HIV at least twice during pregnancy. As we all know that injectables are the most common way through which HIV spreads. So there is also a provision of supplying the free syringes to prevent HIV. But if a person is already HIV infected, how can we treat them? There is therapy called antiretroviral therapy. Antiretroviral therapy is a treatment which is given to the people infected with HIV virus using anti-HIV drugs. The standard treatment consists of various drugs, which commonly known as HART, that is highly active antiretroviral therapy that suppresses HIV replication. ART reduces morbidity and mortality due to HIV and improve the quality of life. WHO recommends initiating the ART therapy just after the exposure to any fluid or any needle-stick injury, or if a person is infected with HIV, regardless of WHO clinical staging or at any CD4 cell count. As Anjali has already told that HIV also transmits from mother to a baby if mother is HIV positive. So if a baby is born to HIV positive mother, baby should be given antiretroviral therapy up to 18 months. This can decrease the chance of baby being get positive to a great extent. ART includes various drugs which lands in different classes. These classes may be NRTIs, which is nucleoside reverse transcriptase inhibitors, which includes lamivudine, non-nucleoside reverse transcriptase inhibitors, which includes netidapi, protease inhibitors, which has darunavir and indinavir, and fusion inhibitors, which includes fostemsavir.
As we are talking about ART, I had the term PrEP. Can you explain what is PrEP?
Yes, PrEP is basically stands for pre-exposure prophylaxis. It is a treatment which includes giving medications to a high risk groups, which reduces their chance of being infected. Studies suggest reduction in infection up to 90% with sexual exposure and up to 70% through intravenous drug abuse if PrEP is used consistently and correctly. Anyone can avail ART at all the government facilities, including CSCs and PHCs. Thank you.
As we have already discussed the first line treatment of HIV, but as a nurses, we are supposed to have a holistic approach for caregiving, considering the physical and psychological trauma that the patient is going through. There are various methods to achieve this, and one of them is healing touch. Healing touch is an energy therapy created by the nurses of United States in 1980. It is the collection of standardized tools and non-invasive techniques that clears, energizes, and balances the human and environmental energy fields. It is a relaxing, nurturing, and heart-centered energy therapy that uses gentle and intentional touches for balancing the physical, mental, emotional, and spiritual well-being. There are neurotransmitters in our body that directly interact with the immune system, enlisting the benefits of the healing touch. Healing touch can have the potential to elicit the relaxing response, decrease the stress, anxiety, and pain, deepens the spiritual connection, and strengthens the immune system. Now, I would be discussing about the further three types of healing touch that are first, massage therapy. Massage therapy is proposed to have a positive impact on improving the quality of life and strengthening the immune system. There are some evidences that prove that when massage therapy is provided along with other stress management modalities, it can improve the living of patient with HIV. Massage therapy can include specific physical technique or manual therapy. For example, deep tissue work, Swedish massage, acupressure, shiatsu, and neuromuscular massage. Second, physiotherapy. According to the physiotherapist Sue Statham of Stellenbosch University, she says that the children with HIV are more prone to suffer stroke than those who are not infected. She says that the impact of physiotherapy on the HIV patients cannot be underestimated. Her words were, when we provide the care to cancer patient to be functional, the patient eventually dies after some time. But when we provide physiotherapy to the HIV patient on antiretroviral drugs, it can change their rest of life. Exercise classes increases the CD4 count, which is the measure of strength of immune system. Now, third, that is therapeutic touch, is the alternative nursing practice which involves the moving of hands over the patient, ostensibly to alter the energy fields. Therapeutic touch may be associated with reducing stress and anxiety, especially in children. All these therapies are safe for all age groups, and these therapies can be used in complementary or in harmony with the standard medical care. Thank you.
As we have discussed about treatment, prevention, and stigma associated with HIV infection, now let us discuss about nurses, who plays a very crucial role in supporting the individual affected with HIV virus, but their roles are often unrecognized in our society. So here, I would like to draw the attention to some key aspects that makes the nurses champions of compassion in the front line of HIV/AIDS care. The first aspect is holistic care. Nurses approach the patients holistically. They not only address physical symptoms, but also social, psychological, and emotional aspect of living with the virus. They consider individual unique circumstances and work towards improving their overall well-being. The second key aspect is patient education. Nurses educate the patient regarding their condition, their treatment options, and prevention, thus empowers the individual to actively participate in their own care, make informed decisions, and also help to reduce the stigma associated with the virus. The third aspect is emotional support. Living with HIV/AIDS can be emotionally challenging, so nurses also helps to provide emotional support to the HIV patients. They offer emotional support through by actively listening to the patient's fear, concern, and their emotions through empathetic communication, by offering reassurance, and they also provide supportive environment to the patient by answering and clarifying their all doubts regarding their treatment and disease condition. The next important aspect is advocacy. Nurses serve as advocates for the HIV patient by ensuring that their voices are being heard and their rights are being respected. They ensure that there is elimination of discrimination and stigma in providing care to the HIV patients. They also advocate for policy changes according to the needs of patient. Nurses even play a vital role in maintaining cultural competency in providing care to the HIV patients. They maintain the cultural competency by respecting and understanding different cultural backgrounds, values, and beliefs. They even provide care to the HIV patient by being sensitive to the different cultures such as religious practices and different dietary preferences according to the patient's culture. They even ensures that the treatment and care being given to the patient align in the cultural context of the patient. Nurses also provide crisis intervention to the patient by being readily available to address immediate emotional and medical needs of the patient at the time of difficult situation. Nurses also play a role in community engagement by providing care to the HIV patient by education and awareness, support groups and counseling, by preventive care and screening, resource navigation, etc. The other very important aspect is collaboration with multidisciplinary teams. Providing care to HIV/AIDS patients involve collaboration of nurses with multiple healthcare professionals, such as physician, counselor, social workers, technician, etc., to provide effective and quality care to the HIV patients. Nurses even collaborate with various associations and organizations, as actually has told about, like NACO and various nurses association and UPSEC, etc. Thus, the collaboration of nurses involves various initiatives such as testing and counseling services, community outreach programs, treatment and care of HIV patients, and training and capacity building of local healthcare workers, etc. Thus, through all these patient-centered and holistic approach of nurses, nurses act as true champions in the fight against HIV/AIDS. Thank you.
As we have discussed already various treatment options, one of the important aspects of the HIV care is counseling. So what is counseling? Counseling is the confidential dialogue between the client and the care provider, enabling him or her to cope with the stress and make the important decisions, such as decisions related to HIV. The main need of counseling the patients living with HIV and the family is to prepare the client for testing, to provide psychological support to those affected and infected with HIV, and to assist the client to lead an active, hopeful, and productive life. The counseling of the patient living with HIV has to be done at various levels, such as pre-test counseling. Since HIV is associated with a profound psychosocial stigma, pre-test counseling should always be done. Such a counseling will help us to prepare the client for testing, to prepare the client for results, and the counselor explains all the needs of testing to the client. The support system of the client is priorly identified, all the misconceptions related to HIV are clarified, and informed consent is obtained by the counselor. Post-test counseling. Post-test counseling is important as client understands the result and copes with the impact of the result. Here, the counselor provides result to the client, prepares the client for the result, and provides the client with the additional information that is required. If the result is positive, the counselor had to tell result to the client clearly, calmly, gently, and as humanly as possible. Results should always be reviewed in the supportive environment. The counselor should provide psychological and emotional support to the client with HIV. It is necessary to prepare the client for therapeutic treatment and ART. Prevention of parent-to-child transmission counseling. Prevention of parent-to-child transmission counseling will benefit the pregnant woman or the woman wanting to become pregnant who are either HIV positive or unaware of their HIV status. Here, the counselor educates the mothers about various treatments, various precautions to be taken during pregnancy, and the transmission of HIV from mother to the fetus. The education about the breastfeeding and various alternative methods of feeding after the baby delivers. This counseling should usually be done before the pregnancy. Family and relationship counseling. Here, the counselor addresses the needs of the family. When one member of the family suffers from the HIV, that altered his behavior and habits in a negative way. The counselor also guides the family towards the disease management and assists the client to have a positive outlook. Crisis counseling. In crisis counseling, counselor addresses the client who are in distress or in shock. The clients having suicidal thoughts, clients facing isolation and rejection, and clients having anxiety and depression due to disturbed body image. Adherence counseling. Adherence counseling aims at enhancing adherence to ART. Here, the counselor provides knowledge about various treatments such as ART and provides knowledge about the side effects and ways to manage the side effects. Then is ongoing counseling. The purpose of ongoing counseling is to provide psychological support to those affected with HIV. Here, the counselor assists the client to enhance the coping skills and assists the client to find the support measures to meet ethical, medical, legal, and daily needs. The following principles to be kept in mind while providing counseling is confidentiality, being trustworthy, autonomy, beneficence, non-maleficence, self-respect, and justice. Why it is critically important to provide counseling to the patient living with HIV and the family is to prepare client for the testing, to ensure adherence towards ART, to provide psychological support to those affected and infected with HIV, to ensure adherence towards the treatment options, and to improve the physical health of the status. Now, I would like to conclude our session. Nurses are playing a very critical role in the AIDS care. It is critical they recognize various HIV patient situations, which are not simply the medicinal ones, because the patient frequently experience stigma and poor adherence. This condition can be helped by the nurse, as nurse ameliorates the situation by advising and informing the patient as well as the family. It is critical to enhance the public awareness of the HIV. Nurses also help in this by sharing their knowledge with the patients, with kinfolks, and others. Nurses are also in trouble due to stress and shortage of the staff. Efforts must be made to man the working conditions of the nurses so that stress can be reduced on the nurses, which will be beneficial for both patients and family. It is also important for us to understand the various issues and stigmas that the family and the client with HIV faces. It will allow us to assess better in the present as well in the future. Thank you.